I'm with Mr. Stephen J. Thompson, CEO of Johns Hopkins Medicine International. Hello.
Hi.
What are you presenting this year at the World Healthcare Congress Middle East?
This year we're discussing knowledge transfer, the way that we take the expertise of our organization and share it with other organizations around the world.
Why do you think an event like this is important?
Well, I think this event is important because it really provides a forum for the sharing of all kinds of information in this time of globalization of medicine.
What are some of the innovations your organization brings to healthcare?
Well, as a research-based organization, we are all about innovation and new discoveries and new knowledge. So some of the innovations that we're bringing this year are really the ways that patients are cared for, particularly around those patients with chronic diseases such as diabetes, hypertension, and chronic cardiac diseases. We, through this knowledge transfer scheme, seek to take the new knowledge that we create at our organization and share it with organizations both here in the UAE but around the world.
What are some of the challenges your organization faces in the healthcare industry?
Well, the largest challenge that we face is the same that is faced by every health system all around the world, and it really is the cost and the value that's created, or the value that's perceived actually by patients and their families around the world.
Especially in tough times.
Yes. There's never enough money. That's one thing that all health systems share, whether it's spending 4% of GDP on healthcare or 15%. There's really, we need to do a much better job of using the scarce financial resources we have to improve health.
Is human capital also an issue? Because that's usually very common.
Yes. Human capital and the development of human capital is really at the forefront of, I think, the ways that we have to succeed in our mission of improving health. We are working on programs to invest in that human capital both at our own institution but then with our partners around the world to improve the quality of education and the quality of skill that everyone from nurses, technicians to medical staff have working towards improving health.
What do you hope to learn or teach from such a conference?
Yeah. Well, I think that one of the wonderful things about forums like this is the opportunity to interact, and I always learn a lot. I think representing an academic healthcare organization, we're often thought of as that we've got it all figured out, but that's actually not true, and so we do learn a lot from each other, and sometimes it becomes or starts as a spark with something that's here and carries on to a longer-term relationship.
What are some of the interesting ideas or discussions that you've experienced so far?
Well, I think we just came from a session where we talked about knowledge transfer, and I think that the ability to customize that knowledge and create it and present it in a way that is culturally sensitive and locally adapted to local conditions is really something that has me thinking that we can continue to work and improve on that.
Because the expertise is definitely needed, but if it's not done in a way where the culture can adapt it and it does not go well with tradition, or if it's not presented in a way that goes well with tradition, it might be difficult.
Exactly. Things that work in
culture
one
to
place.
Culture, exactly.
Yeah, it's not, in healthcare I think it's owing to its complexity, it's not that we can package up what we do in North America and bring it to another part of the world and open it up and it'll work the same way. It absolutely will not. So we have to continuously adapt and customize and localize that information for it to be effective.
How do you do that, and how do you overcome such challenges?
Yeah. So one of the things, we have the benefit of years of experience to do it. I think that what we do is we have trained culturally sensitive instructors and staff so that we are open to the subtle cues sometimes of culture and then able to quickly incorporate that into our work and our presentations.
Thank you very much.
You're welcome.
Mr. Stephen Thompson, it was a pleasure speaking with you.
Thank you very much.